Hey, there we go. Hi, everybody. Thank you for joining me today. My name is Dr. Jo White. I'm a clinical psychologist and advanced certified schema therapist and supervisor. And I'm really looking forward to chatting about all things schema therapy related with Chris Hayes, who's my guest today. Chris, would you like to introduce yourself?
Hi, everybody. My name is Chris Hayes. I'm a clinical psychologist. I'm over here in Perth, in Western Australia, on the other side from all the stuff that people know about in Sydney and Melbourne and Brisbane. So it's the most isolated city in the world, Perth is. So I'm a clinical psychologist here. I do a lot of training here in schema therapy. I'm an advanced accredited schema therapist. I've sort of trained with Jeff back in about 2006. And then, yeah, sort of, I was saying before, like, helped out with a training program in the UK. Then, moved back here about 10 years ago. So, but I do a bit of private practice as well. Prior to that, I probably spent about 10 years in the health department here in Western Australia, working with a lot of like a special service that work with sort of sexual trauma, like sexual assault and childhood sexual abuse. So did that for a long time. So I got a bit of a special interest in trauma and doing EMDR and things like that, and integrating that with schema therapy. So yeah, so that's me. But also just a plug, I've just written this book. Did I mention that,
So we're
Joe?
going to talk about the book a little bit more later, but
Yeah.
just so that everybody knows, if you add a comment to the chat underneath the live stream, then we're going to choose a name from all of the comments, and you can win yourself a free copy of Chris's new book.
Well,
So
not my book, but our book.
your book, along with
Yeah.
some other writers, yeah. So do
Yeah. So,
comment on the interview, and you'll be in with a chance. I guess the comment needs to happen in the next 24 hours, and then I'll pick a name out.
yeah,
Um,
fantastic.
so
Yeah.
so we're going to have a think about some of the tips that Chris has got in terms of improving quality of schema therapy, and some troubleshooting some schema therapy pitfalls together too. So I'm really
Yeah.
looking
Yeah.
forward to hearing all of your suggestions, because I know that from supervising lots of schema therapists right now, there's all sorts of things that come up after training for people, and all
Yeah.
sorts of things in terms of improving sessions, that tips that people really love to hear about. So it'd
Yeah,
be great if you can
absolutely.
share things
Yeah.
with us.
I think for the writing of the book and also doing, a lot of training, probably, I don't want to count how many workshops we've done, but you start to pick up particular things, and also listening to tapes. I mean, you're probably the same, where you start listening to tape ratings over and over and over again, and you can instantly pick up some ideas. And it's it's tricky sometimes when you're learning how to do that, to actually kind of put words into the feel of what you're looking for. So I was thinking about a couple of different things that we could kind of talk about, just to kind of immediately sort of spruce up someone's session, sort of sprinkling your session, maybe kind of make it a little bit more punchier. If that
Mm-hmm.
makes sense.
Mm-hmm.
I mean, one thing I thought is that a lot of people like schema therapy. I don't know, but if it's the same for you, but some people kind of like the idea of doing experiential techniques, but also kind of they're terrified of using it too. I don't know if you feel that same way. Um, yeah,
Yeah, I
and I
think
think
I think certainly there's some trepidation when people have learned schema therapy techniques in training to get started, and then some people kind of throw themselves in straight away.
yeah, and experiential techniques are a really big part of schema therapy. I mean, I would say that's quite a cornerstone component. And if you've done sort of cognitive behavioral work, that you often see people kind of gravitating into that, into doing more cognitive work, or kind of ending up being more supportive psychotherapy. And the big quest that I often will have with my supervisees or people that are learning the model is, if you're really doing schema therapy, really you need to kind of see things like experiential work as being kind of part of the essential furniture of the model. And sort of being, there's differences between you avoiding it versus the client avoiding doing experiential work. So what I'm saying by that is, chair work, imagery, anything to do with emotion, even doing kind of attunement work can be kind of quasi experiential, because you're trying to connect with emotions that are underlying. But one thing that I tend to kind of think, there's a couple of things, but one thing I say to a lot of my supervisees is have a structure to your session. Okay, so a lot of the time, no one really, I mean, in terms of the schema therapy model and a lot of the literature teaching, people, they never really told me how to sort of stay on task in a session. And what I think it's really important to have is a kind of a three-part element to a session. So I kind of talk about having the tune in. Okay, so that's the first 15 minutes where you are looking for particular triggers. You look maybe talking about homework. You're tuning into the client. You're really kind of maybe doing linking. The attunement is really high. You are maybe focusing in that component. You're using a lot more direct, limited reparenting type stuff. And then, you kind of might mode out a difficulty. So, for example, if, your boyfriend hasn't called you last night and you're really upset, or your girlfriend has, sort of decided to leave you, you could talk a bit about you moding out that experience. And then the second component, and this is the bit that's probably the most important if you kind of want to do more experiential work or kind of trying to get into that, is you get to a point 15, 20 minutes into the session where it's like, what's best use of the time today, Joe? Or whoever it is. And I think that's the question, having that like implicitly in the back of your mind, that if I'm not doing the work, which is the second component, so the tune in, the work is, okay, what would be best use of the time? How about we do some imagery on this to get you connect with your feelings? How about we do the flashcard or whatever it is? I mean, but you've got a couple of components where you could do experiential techniques in that. And then you've got your 30 minutes of that or 20 minutes of that. And then you've got 15, 20 minutes at the end for the wash up, which is what did you learn from that? What were the take homes from that? Is there anything that you can think you can move things forward in terms of homework? I think that's a really easy way to keep yourself accountable rather than having this drift where it's supportive psychotherapy and you say schema 5 times. So that's one thing I think. I don't know if you relate or not that to yourself,
Yeah,
Joe.
I
You've
think
listened to.
I was just saying, wasn't I, that we ran some training last week, and that was something that people found really containing, was having this divide into 3 sections for your sessions. And
Yeah.
I think it's just helpful to hold that in mind, isn't it? Okay, so the first sort of section, 15, 20 minutes, really working out, okay, what are the dilemmas here? What are the struggles?
Yeah.
What could we be doing something with? And then moving on to, okay, what are we really focusing on? And I think that's helpful for clients as well to know, isn't it? That this is the bit of work for today. There might be all of these different issues, but we've chosen one and we're really focusing in on that so that we can make some shifts here. And then, of course, without the review at the end, that's a massive opportunity for learning, isn't it? At that point, for people to be reflecting on what they're taking away.
Mm-hmm. Yeah, I've got a lovely client of mine, and she kind of came clean. Recently we kind of have a joke about, saw it today, and she was just saying, this is a decoy issue. Like she'll be clean, so she uses these decoy issues, and normally I would have been like, chasing around. And she's very good at it. She's very good at avoiding things. And, so I guess that's the thing, keeping yourself accountable. And also, that what would best use the time, it helps you kind of dodge decoy issues. But another thing I thought about this as well, when we were sort of reading the book, I guess the part of writing this book is crystallizing what you implicitly know, was when we try and get people to do imagery or chair work or, even see, any cognitive work, really, anything like that, like trying to have an explicit understanding in your head about what you're trying to teach the client. Like, I get a lot of people coming to me going, and you can tell listening from the tape or watching live, recordings. You can tell it's kind of like, you told me to do some imagery, but I don't know why I'm doing it. So thinking of like, some things, for example, like I'm trying to teach the client how to be more compassionate to themselves, or I'm trying to help them understand the origins of their difficulties and where this pain is originated from, via imagery, or I'm helping them to try and reattribute some of this stuff to other, causal agents that, as a kid, you just absorb this sort of stuff. Or I'm trying to help you feel more compassionate, or sorry, more empowered. That's why I'm trying to get you to do chair work. I want you to feel more empowered so you can have a voice that you're not allowed to have a voice when you're as a kid and this sort of stuff. So that's one thing I definitely think is worthy to have in your head. Like, what is the point? What are you trying to teach the client from that? And that will help you, even in terms of, maybe the responses in those imagery, what chair work or any, interplay that you have. It's
Mm.
kind of useful too.
Mm. I think
Um,
it's hard, isn't
yeah,
it? Early days of schema therapy. Well, I think even, when you're quite well into your journey, it's such a big model, isn't it? And there's such a lot to
yeah,
get your head around. I can
yeah,
understand people going into imagery scripting and thinking, well, I'm doing it because the book tells me to, or because the
yeah,
trainer
exactly.
told
Health,
me
yeah,
to.
absolutely.
But it's depthening the level of understanding, isn't it? And linking to the case conceptualization as well. That helps people
Yeah,
to really recognize, okay, why are we doing this? And then shapes
yeah,
up the section that you're calling kind of wash up, the review, the debrief at the end. If you
yeah,
know what you're trying to teach your client, then you've got a bit of direction, haven't you, for that
yeah.
review period?
And you know what? Another thing that, just as we're saying this as well, is that I really think that often a lot of trainees and people learning the model get into the model. It's interesting when a lot of people have I kind of get my supervisees can pick up this early because I sort of jump on it really soon. Because often when people come and they want to talk about their clients, they go straight into the trauma stuff, and it's like gnawing on a bone, and it's all kind of juicy stuff. But I'm always like, hey, hold up, let's just why are they coming to see you? That and what are their problems? And this idea of definition of a problem list or about key central themes and problems that you're trying to change, that is really essential too. That relates to what we've been saying before. So I think Arnoud at a training, Arnoud Arts, at one point, I remember him saying, you can't solve a problem if you don't know what the problem is.
Mm-hmm.
So, yeah, kind of going into that, and maybe that's part of the conceptualization period too, of like sort of trying to kind of clarify that. Yeah.
Mm-hmm.
Do you have many of those sort of clients that I don't know what I'm trying to change?
Yeah,
Yeah.
absolutely. And I think I always found that quite tricky when I was training in schema therapy, is really kind of breaking it down and using the mode map as a way of helping you to understand, okay, what does resentment mean? You're struggling with resentment, but what does that actually look like in terms of the mode
Yeah.
map?
Yeah.
And I think that's quite an important skill, but a complex skill to develop, to be able to really break down a problem into the modes that are at play.
Yeah, absolutely. Absolutely. So a couple of things I've just jotted down. Another thing that keeps you accountable, this is in terms of the session, is this idea of if this was like a blind rater and they were listening to your tape and they had, okay, we're doing a research study and there's 6 different types of therapy, and your job as the rater, you're not going to tell you what it is, but you're going to rate each one and put them into each category. So it's kind of like if it was, CBT or supportive psychotherapy or DBT or transactional analysis or something, EMDR, that you're going to hear particular things. So like, if this is rated by a blind rater, how would that know it's chemotherapy? And I think sometimes, in my ratings, I'll be sitting there going, well, 20 minutes in, I don't know if I don't know if this is really, I don't know, it could be anything, you know. Do you have that?
So what are you looking out for, Chris, when you're
Well, I mean,
listening or
I
watching
guess
sessions?
there's obviously the techniques that are different. So that would be something that's very easy to see, the idea of like, what would be good use of the time now and going to that. But even that first 15 minutes, I don't know about you, but like liminary parenting is instantaneously identifiable from just listening to the client and, and be direct in terms of care and this sort of stuff, like telling the client that you care about them and maybe appropriate self-disclosure might be going in that. There's the atmosphere and the liminary parenting, and it may be also the empathic confrontation element of that. Like, you'd be hearing that, maybe that kind of component at the first 15 minutes. But I guess moding out, talking about, like you said before, about resentment, for example. Someone might go, oh, yeah, it sounds like you've got a lot of resentment. A schema therapist might go, well, let's understand that. So, so there's an angry part of you, there's vulnerable, it's like an angry child part, I think, is it resentful. And then there's a vulnerable part that feels powerless, maybe, yeah. And then there's this part of you, what's the default side of you that deals with, dealing with people, it probably avoids, dealing with conflict, and then that builds up as resentment and understanding maybe that, or formulating it in that way. So yeah.
Yeah,
So
so starting
what
to
about
look
you?
for the life patterns and
Yeah,
I
look
guess
for life
doing
patterns.
some linking from present to the
Yeah,
past
and linking it.
potentially.
Yeah. So
Um,
speaking about the problem in terms of schemas and modes,
yeah,
that's obviously that's going to go, hang on, we're talking schemas and modes now.
yeah.
But yeah. So I know that we're running the time and stuff, but the other thing I wanted to sort of talk a bit about, in Melbourne, there was the Enlight conference, and obviously it was a long way away from a lot of the guests, or a lot of members, the ISST members, and people that are interested in schema therapy from the Northern Hemisphere, and other hemispheres. Melbourne's a long way away. Um, but I did a training in that, in regards to how to best, like, say, if doing experiential techniques, how to best sort of deal with antagonists. Jeff, in a lot of his early writings, would talk about, you need to win the exchange. But sometimes that can be a bit, I don't know, I think a lot of people go full, UFC on antagonists, I don't know whether that's necessarily that helpful sometimes,
Mhm.
you know. So I've come up with this like little acronym, and it was, with our trainees, we talk about kind of helping the therapists to kind of fire up. Right? So fire up stands for being firm. So if you're coming into the image, it's the tone of what you're responding to. So if you go into the image, or even if you're doing chair work, you're talking to a critic mode, or even a coping mode. You can be firm. So you could be saying, "Don't talk to her like that," versus "Don't talk to her like that." That's a kind of firm versus not firm. So being firm, being in control, like you don't really need to kind of get angry and kick off. You can just be calm and and even say, "I'm in control here and you're not. I'm dealing with this now and you're not having a say," that kind of idea.
Mhm.
So firm, in control, resolute. This idea that it's not it's like you're arguing. It's like, I'm not arguing about this. I'm right. That's not the way, especially with punitive critics.
Mhm.
This idea. Um, Being empathic. So it might be the guilt-inducing mum who's on the couch sad, or the dad who's crying into a bottle, sort of thing. Look, I get it. It's hard. Parenting's tough. I'll get you some help. That kind of idea in the imagery, or kind of, being able to, again, you could use some of these ideas with chair work too. So that's the fire bit. So being firm, in control, resolute, empathic. And the last two bits, being uncompromising. So, I'm not budging on this. I'm not gonna, give in to you. And punchy. What I mean by punchy is that, I don't know about you, but you listen to a lot of imagery, and it could be like I recently heard one. It was like about a 4-minute monologue to an antagonist, like either a dad or mum in the image, or a bully. And there's a lot of material in that's great, but it just gets lost.
Mm.
So, keeping it punchy, saying one or two lines, and reflecting, what's that like? How does that feel? Like, I don't like what you're saying. I want it to stop. It's going to stop. What's that like? How does that feel? That's the kind of angle you want to get to. So, knowing some of these kind of constructs, sometimes that we don't normally talk like this. Let's face it.
Yeah, I think that's particularly
Don't take this
important.
anymore, Joe.
I think it's particularly important in terms of the punchy,
Yeah.
particularly thinking about getting the feedback from your client, because at the end of the day,
Yeah.
it's how they're responding to it, isn't it? How it feels to them to have
Yeah.
you saying those things to
Yeah.
a parent or a bully or.
Yeah. And you don't have to be angry, and you don't have to
Mm-mm.
be, but it's just about being firm in your
Mm-hmm.
belief. So with a punitive critic, I need to be firm. With a demanding critic, I understand, I get it. For you, you think that's right, but that's not what I think is the best way to go about it. And I know I'm right. So come on. So you can still do that kind of stuff. But I've
Yeah,
just
it's more
seen
of a
a lot of,
negotiation, isn't it?
yeah, and empathizing as well. You're empathizing. I get it. You mean the best, but
Mm-hmm.
this is too much. So this sort of stuff. But it's
Mm.
just, we don't normally talk like this, and we want to get a corrective emotional experience. So it's just trying to find the constructs of what's the best outcome. I've had lots of people kind of either, including myself. I remember when I was learning how to train and doing early training. I always remember doing this training with Arnie Reed, where I would just overcompensate. I'll be like, "Don't you ever talk to him like that?" And I remember talking to this lovely man next door to me, and I was like, "How's that for you?" And he was like, "Oh, that was quite intense." So I think the model has evolved, and some of the cultural elements maybe of where schema therapy is originated, where it's a lot more hostile, adversary driven, and banishing and this sort of stuff.
Mm.
I kind of
Yeah.
think it's more about the setting. Yeah.
And the repeated messages, knowing that we're not just going to go in and do imagery with the punitive critic once, are we? This is something that we're going to
No.
revisit with our
Yeah.
clients. And so it's okay
Exactly.
to build those messages up over time. We don't have to go
Yeah.
there
Yeah.
and destroy the critic in the
Yeah,
first
and even
attempt.
destroying, it's a kind of like it's for me, and it's a personal
It's
style thing, but
unhelpful,
it's
isn't
about
it?
setting limits. It's like,
Mm-hmm.
I get it, but I'm not interested, and this is going to
Yeah.
stop. So,
Yeah.
but you're right. It's one thing that I think a lot of people learning the model as well. They're going to think they get the idea of the imagery, and they're going to go, "Oh, cool." It's not. It's like chemotherapy or something. You don't give someone just a quarter of the dose. And I think, I was involved with Anu's study looking with Katrina Bodahaven Dahan here in Perth, looking at imagery scripting in EMDR for childhood trauma. And that protocol was 12 sessions of imagery, where we did 6 sessions of, the therapist going into the image, and then 6 sessions of the therapist, the other way around, the therapist going to the image, and then 6 sessions of the client going to the image. Obviously, we've got different kind of issues and the strengths of people's healthy adults and their coping minds are different, but yeah. So I think you're very right on that.
Mm.
Yeah.
So should we have a think about some of these what ifs then for the
Yeah,
final sort of
sure.
5 minutes? So
So
a really common one that comes up, isn't it, is what if the client feels really loyal to a caregiver? I think that's
yeah.
a super common dilemma that comes up in supervision. What do you
Yeah,
do?
and it can be kind of cultural too. Like you get a lot of
Mm-hmm.
loyalty issues, particularly in sort of Asian cultures. There's a lot of stuff around enmeshment, and there's a concept in Asia and Confucianism called filial piety, which is like being very loyal to respectful to elders and things like that. So I guess in terms of this sort of stuff, you could talk a little bit about healthy loyalty versus unhealthy loyalty. You could do that in more of a cognitive way after sessions, or trying to understand what that is. I think this is where that idea of being empathic to the caregiver in the image can be really useful. It's not about blowing them away or anything like that. It's more about empathizing. I get it. It's understand this is, and showing. You could often with some of these antagonists as well, you can still show them respect. You can even say that I have a great respect for you, Mr. So and so, but I don't agree with what you're saying. This sort of stuff. Also in the image, like it's the vulnerable child mode that is feeling loyalty. So responding to that, this is a big person's problem, I'll look after dad, and I'll look after it. I'll deal with it. This sort of stuff as can be quiet, because often clients like that, they feel a lot of sense of responsibility maybe as well.
Mm-hmm.
And also got another one. What if the client doesn't want to do experiential techniques? They don't want to do a chair work exercise. Is that something that you relate to? Like, the supervisor is talking about
Yeah,
people
yeah.
refusing doing it?
I think
Yeah.
often that's around people's confidence of going in and inviting the client to do something that feels really different to the work that they would normally do.
Yeah. Yeah.
So often I think the
Yeah.
anxiety kind of sits with the therapist around that.
Yeah.
What
Yeah.
do you find?
Yeah, I reckon client like joke around, and I say it from a very caring, compassionate way, but I think clients can exploit our weaknesses. So if we don't look particularly confident, then I mean, if I was a client, I'd be like, well, we're going to talk to a chair or something. Is that serious? And then I would go, oh yeah, you're right. It's just this silly idea back into my box. So, I think you're absolutely right. And the more confident you are with doing experiential techniques and particularly chair work, they'll go along with you. If they don't want to go with you and doing a chair work, you just do it around them. The part of you that doesn't want to talk about the chair work, doesn't want to do the chair work, I'll put that here. And you can just do it around them, and they don't need to move. It will still have a good effect. So, if you've got clients like that, that's what I would roll with.
Yeah, I often will
Um,
ask people to, so that avoidant part of you, what's that saying now? So instead of
yeah,
getting them to sit in the chair, what would it be saying? Imagine it's sat over there.
yeah,
I think that's
absolutely.
a good
Yeah,
first
yeah,
step. Mm.
yeah, absolutely. The one. I mean, when we're writing this, we're looking at sort of different what ifs. Another one is like clients not liking limited reparenting, feeling icky, feeling awkward, kind of reacting negatively to kindness, for example. It's pretty common. I think it's usually driven by emotional deprivation. It's all a bit wet and icky,
No,
that
it's
sort of
really
stuff.
unfamiliar, isn't it, to
Familiar.
lots of
Yeah.
people?
Yeah.
Yeah.
So I wouldn't give up on it. You might want to titrate the amount of direct limited reparenting you're doing, but you could do it indirectly. You could kind of sort of gesture and talk to an empty space. I'm talking to the vulnerable part, or put into a seat if you want to do that way, and talk to the vulnerable child in the seat, but watch the client observe that. That can be something that could be quite useful. I think also just talking about it. I always remember the analogy with emotional deprivation of the feet in the snow when you go for a walk and hike in the snow and you get really cold feet and vasoconstriction kicks in, you start the warmth, and find your little hut, you go then there's warm water, put your feet in there's really warm water, cold feet, warm water. It's intense. You want to take it out, it's overwhelming. It's the same thing with emotional warmth with from therapists.
Mm.
So I think just normalizing that and titrating,
Mm.
not giving in to that. That's pretty important too. Yeah.
Yeah. And I think that's tricky for therapists if they've got um, if they're struggling if they're a bit more emotionally inhibited and they've got a client that's struggling with the limited reparenting, then I
Yeah,
think it can be
absolutely.
really
Yeah.
triggering for therapists as
Yeah.
well. And okay, I'll just
Yeah.
back off on that.
Yeah, you're right.
So
Okay.
I'm
Let's
kind of
do something
leaning
on the
into that.
whiteboard.
Mm-hmm.
Yeah, exactly. And that's I mean, it's a big thing, is knowing your own stuff and knowing your own schemas. And
Mm-hmm.
one of the big things I think, you're probably feeling the same way, is that, knowing your own schemas and how they operate, and it's how it can help you become much more nimble as a therapist to know what you're avoiding and build a bridge through that. I know personally I've had to do a lot of that myself with particular schemas. Someone was never good at, assertion and subjugation was a bit my thing for a while. So I think I built a bridge over that, but it takes time, and you can't just put your head in the sand. So that's a really big thing.
Yeah. Yeah.
Yeah.
But the beauty of
So
supervision, and we're
yeah.
inviting people, aren't we, to work on their own material in supervision as well to
Yeah,
get through some of
absolutely.
those blocks.
Yeah, fantastic. Yeah. Yeah.
Oh, thanks so much,
Yeah.
Chris, for sharing
Pleasure.
those
Yeah.
ideas and thoughts about how to improve quality in schema therapy.
Yeah.
I
And
think
look,
there's
thank you for having
it's there.
having me. I really do appreciate that. The whole community that you've got going has been next level, and it's amazing. And I'm always having a look around and suggesting to people to jump on to your group. So yeah, look, I just want to say well done. Good
Mm.
stuff.
Thank you. Thank you. It's a pleasure to run it. So, and obviously I've got lots of great help from Tanner and Gemma as
Yeah.
well.
Yeah.
So
Yeah. Yeah.
yeah,
Yeah.
it's
Yeah.
great having
Yeah.
everybody part of the group. And I think
Yeah.
you've also got a discount code as well, haven't you, for your
Yeah, yeah,
book?
yeah, yeah.
Mm.
So what I'll do is shall I put it up on should I whack it up? Should I just
If
post
you
it up? Yeah, is that
if
okay?
you
We'll
we
do
can put
that,
it on
or
the Facebook group, yeah, if you
yeah, yeah, cool. Go on and
put
post
it
it
in
up.
the
It's
chat.
20% directly from the publisher. So yeah, the book
Great.
is the Cambridge Guide to Schema Therapy. It's with Robert Brockman, Susan Simpson, myself, and Renko van der Weinhardt. I've been working on that, and Matt Smout. So a really lovely, like legendarily nice guys to work with, and great, great, sort of lovely way to write, and we got a lot out of it, personally. So yeah,
Mm.
but hopefully it's designed for trainees and people learning the model. It's from a teaching perspective, really, based on our experience of teaching it and listening to a lot of therapy and doing a lot of therapy as well. So yeah, it's very updated, and it's come out 3 months ago. So yeah.
Yeah, I think it's a really brilliant addition to the books that we've already got written about schema therapy.
Yeah.
And it's one of my top recommendations for my supervisees now, having
Nice.
worked through it as we're writing our program. So I'd really recommend that people get hold of it, and there's so much depth in there, but also it really broadly covers schema therapy as well, and lots of great tips around things that people struggle with in terms of, okay, what am I actually aiming for in schema therapy? What's the overview here? And lots of great tips for when people are getting stuck. So I highly recommend people get hold of a copy. And thanks for all of your work and the work with the other authors in developing it, because I know writing a book is no mean feat.
That was a real
challenge.
Baby. Yeah.
Thanks for joining me, Chris.
Thanks so much for having us.
Lovely to chat to you.
For having me.
And I'm sure everybody will appreciate it. And maybe if there's any questions that people have got in the chat, then you can join me in answering some of those as well.
Yeah, absolutely. Yeah, be happy to do that.
Okay. So thanks very much, and
thanks so much.
see everybody again soon.